Are you ready for the next frontier in cancer treatment? Join us as we delve into the groundbreaking world of cancer vaccines, exploring the science behind these game-changing treatments, the approved options available, and the cutting-edge developments in the pipeline. But it's not all smooth sailing. We'll also take a look at the challenges faced by scientists in their quest for breakthroughs. Get ready to be amazed by the potential of cancer vaccines to revolutionize the fight against this devastating disease. But how exactly do these treatments work? Let's take a closer look at the science behind cancer vaccines and how they can help the body's own immune system fight back against cancer cells. While vaccines are usually used to protect us from diseases, cancer vaccines offer a different approach. These potential therapies aim to treat individuals who are already suffering from cancer. The development of these treatments has been a long and often difficult process, with numerous setbacks and failures along the way. However, recent advances and promising results in clinical trials have generated hope that cancer vaccines may soon become a viable option for treating this devastating disease. In recent years, technological advancements such as genome sequencing have allowed scientists to delve deeper into the genetic abnormalities of tumor cells, aiding in the design of more targeted vaccines. At the same time, we have gained a greater understanding of how the immune system recognizes and destroys cancer cells. Despite being in its early stages, cancer vaccine research has shown promising results from clinical trials testing various vaccine candidates against various types of cancer. Experts in the field, such as cellular immunologists and hematology and medical oncology specialists, are hopeful about the potential of these vaccines to effectively treat and potentially prevent cancer. The ultimate goal of cancer vaccine research is to develop vaccines that can effectively destroy cancer cells. Some scientists are also exploring the possibility of using vaccines to prevent high-risk individuals from developing cancer in the first place. While this aspect of cancer vaccine research is still in its early stages, the potential to not only treat cancer but also prevent it is a promising and exciting prospect. Now, let's discover the science behind these game-changing treatments. All vaccines, whether for cancer or COVID-19, aim to teach the immune system to recognize and attack specific targets in order to keep the body safe. For example, the COVID-19 vaccine provides a preview of the SARS-CoV-2 virus to the immune system, so that when the virus infects the body, immune cells can quickly locate and eliminate it. Similarly, a cancer vaccine educates the immune system about the characteristics of tumor cells, enabling it to seek out and destroy these abnormal cells. By educating the immune system in this way, vaccines can help protect against or effectively treat diseases. What sets cancer vaccines apart from other immunotherapies, such as those using therapeutic agents like cytokine proteins and antibodies or genetically engineering immune cells to fight cancer, is their ability to educate the immune system. While these other approaches also aim to enhance the body's immune response to cancer, cancer vaccines do so by specifically teaching the immune system how to recognize and attack cancer cells. This unique characteristic of cancer vaccines makes them a promising option for treating cancer and potentially preventing its development in high-risk individuals. According to experts, cancer vaccines have the potential to eliminate cancer cells that may have survived other treatments, inhibit the growth or spread of tumors, or prevent cancer from recurring. These promising capabilities make cancer vaccines a valuable tool in the fight against this complex and devastating disease. To create some therapeutic cancer vaccines, researchers extract immune cells known as dendritic cells from a patient's blood and expose them in a lab setting to proteins from the patient's cancer cells. These educated dendritic cells are then returned to the patient in the hope that they will stimulate and instruct other immune cells, such as T cells, to identify and eliminate cancer. This approach is based on the belief that by educating the immune system, it will be better equipped to recognize and attack cancer cells. T cells are capable of one of the most impressive feats in biology. These immune cells have receptors that can identify and bind to proteins on the surface of tumor cells, much like a lock fitting a key. Once bound, T cells use physical force to puncture and destroy the tumor cell. However, some experts believe that vaccines have not been successful at producing enough high-quality T cells to effectively eliminate large tumors. It is often best to use the vaccine when the tumor is still small, according to an expert in the field. To increase the effectiveness of the vaccine, researchers may combine it with medications that strengthen the immune system's ability to attack the tumor. To create cancer vaccines, manufacturers are increasingly utilizing mRNA technology, which is also used in COVID-19 vaccines. This technology directs dendritic cells in a patient's body to produce proteins or peptides specific to the tumor, triggering an immune response. Some vaccines are prophylactic, meaning they teach the body to destroy viruses that can cause cancer, such as hepatitis B and human papillomavirus, effectively preventing an infection that could lead to the development of a tumor. Could the key to defeating cancer lie in the power of vaccines? What are the approved treatments available, and how do they work to fight the disease? The U.S. Food and Drug Administration approved the first therapeutic cancer vaccine, called Sipuleucel-T, in 2010 to treat advanced prostate cancer. The vaccine targets an antigen called prostatic acid phosphatase, which is found in higher amounts in cancerous prostate cells. Clinical trials demonstrated that patients vaccinated with Sipuleucel-T lived an average of 4 months longer, although the size of their tumors did not change. Other vaccines that are approved to prevent viral infections, like hepatitis B and human papillomavirus, are also considered cancer vaccines because they can prevent these viruses from causing liver, cervical, head, and neck cancers. These preventative vaccines work by generating antibodies against a virus, but they do not generate a very effective T-cell response. Therefore, they cannot be used as a therapy to treat cancer. Now let's explore the cutting-edge cancer vaccines in the pipeline. What's next in the fight against cancer? Number 1 has some good news for the ones who suffer from melanoma. Scientists are conducting clinical trials to test numerous cancer vaccines, often in combination with other immunotherapies, for various types of cancer, including skin, breast, bladder, prostate, and pancreatic cancer. Last week, Moderna, a vaccine manufacturer, announced that its candidate mRNA vaccine for stage 3 or 4 melanoma, in combination with the drug Keytruda, showed a 44% reduction in the risk of cancer recurrence or death among patients compared to those who took Keytruda alone. Moderna's personalized mRNA vaccine works by teaching the immune system to produce T cells against 34 cancer-specific antigens. While the results of this Phase 2 clinical trial have not yet been peer-reviewed, Moderna and Merck are planning a larger Phase 3 trial in 2023 to further test the vaccine's safety and effectiveness. Number 2 is related to colon cancer. A cancer immunologist at the University of Pittsburgh is testing a preventative vaccine that can be given at a pre-cancer stage, when an individual develops benign growths called polyps in the colon. These polyps are not dangerous but can become cancerous. The vaccine targets an abnormal form of a protein called MUC1, produced by some non-malignant colon polyp cells. In a study of nearly 50 individuals with advanced polyps, the vaccine resulted in a 38% reduction in recurrence within 3 years. According to the immunologist, if an individual does not develop new polyps, they will not be at an increased risk of colon cancer. A key focus for scientists is to understand why some people respond better to cancer vaccines than others, and how long they will be protected by the vaccine. In the meantime, researchers hope to see more vaccine candidates move on to Phase 3 clinical trials, where their safety and effectiveness will be tested in a larger group of patients. Now let's uncover the obstacles on the path to progress. We will take a deeper dive into the 3 challenges faced by scientists in their quest for breakthroughs. 1. Some scientists remain skeptical of the potential of cancer vaccines. They wonder if the vaccines will be strong enough to shrink tumors significantly, and if alternative treatments may be more effective. 2. It is uncertain if the vaccines will perform well in patients with advanced cancer, as their immune systems may be weakened. 3. Further research is needed to determine the most effective patients and clinical settings for cancer vaccines. Thank you for joining us on this journey into the exciting world of cancer vaccines. We hope you have a better understanding of how these treatments work and the potential they have to change the way we fight cancer. If you enjoyed this video, be sure to hit that subscribe button to stay up to date on the latest developments in medical research. And if you're looking for great content, be sure to check out the video on the screen. We highly recommend it. Until next time, take care.